for the session they can watch. Okay. Yeah. Yeah. So again, welcome back to the next session of the PrepMedico's PLAB series. And today we'll be discussing yet another important topic of the ethics and dealing with difficult patients and medical errors. Yeah. So I will. Today's speaker is Dr. Nishita Gandhi. Again, she is a GMC registered doctor who is going to join her job here in the UK very soon, and she will be starting the session. Over to you, Nishita.
Okay, thank you, sir. Thanks for giving me this chance. So today we have a list number of participants. I think we have 3 of you guys. So I would firstly like to tell you to please utilize this session because it's only 3. And whenever I take
No,
any
but
mocks or if I
candidates will join. Don't worry, Nishita. People
I'm
will come.
hoping.
Yeah, yeah,
But
yeah.
I'll just ask you guys to just concentrate on this one because this is a very small topic which I'm going to teach today, but it is a very important topic. If you'll attend this class and like just sit for 1 hour, at least 1 hour, then I can guarantee you if these 2 cases come, you will ace it for sure. Okay. So be very focused about it, about this about today's session, because the best part is it's a short session, it's a short topic, and it is something which you can grab just now. You don't even need to read afterwards. You just study with me. You just do it with me with time. After 1 or 2 hours, you won't be able to read again. There's no need for you guys to read again. You can obviously, but there'll be no need for you guys to read again. Okay. So okay, so now I'll be starting with the sessions. So today's topic is ethics, but my friends have already discussed about ethics. So we are going to take subtopics of ethics, that is basically how to deal with the angry patients. There could be many reasons why the patient is angry, so we will discuss about that. And second thing which we are going to deal is medical errors, which may be made by us, by our team, by the mechanism or the management which we have, by the machines. So there could be many kind of errors. That is something which we are going to deal. And today I'm going to tell you a few important topics that are definitely going to be get asked, because basically what I'm going to do is I'm going to take you from the start till the end, how the patient is going to react. It's like I would suggest you will make patient ask a question. Don't be like, okay, it shouldn't be surprised. Okay, the patient is going to ask you this question. Oh, then you'll be thinking, oh, what should I answer about it? No, the moment you will start your station, you will have an idea. Okay, so my patient is going to ask me these questions. So in my mind, I have to be prepared about that. Okay, because these are some scenarios in which you can't go unprepared. Because suppose if a patient asks you something like, doctor, who is responsible for all this, why this happened with me, what will you do? So these are some things which you should know from the starting. Okay, this is not like what is the medicine we should take. That is something which we'll be knowing obviously, but these are some ethical things. Okay, where no one is wrong, where no one is right. So we have to go for a middle way where you can satisfy the patient and yourself as well, and keeping in mind about the hospital safety as well. Okay, so now we are going to start the sessions and I'm going to start the slideshow. Okay. Can you guys see the slide?
Not yet.
Not yet, just a second.
You share your whole screen
Sure.
instead of tab or window, and then
Okay.
bring the slide.
Okay, whole screen, yeah.
Yeah,
Yeah, I hope you guys can see it.
yeah.
Okay, thank you. So as I already discussed, that today's topic is ethics, basically dealing with angry patients and the medical errors. So we'll start now. So firstly, I would like to ask you guys one thing. If anyone wants to volunteer, how will you differentiate whether it is a case of a medical error thing or a angry patient thing? Can anyone answer? Okay.
No one.
So,
Yeah, you can continue. Yeah.
so, um, so it's like when you enter the station, you will have a patient. You will have a patient who is angry. Okay, or you'll have a patient who is not angry, who will be very much neutral about the things. Okay, then you'll have in your mind, okay, maybe this is something which we have made a mistake and we have to confront the patient and tell him, okay, this thing has been done from our side. But when you enter and the patient is angry, you have to be prepared about it. Then how are you going to go in? You have to go inside with a neutral face. But when there's a medical error, a patient doesn't know anything, don't go with a neutral face or a bit of anger on your face. Go with a smile. Go like a very smiley face, like, okay, everything is okay, we are going to take these things forward. Okay. And when you have decided whether it is a case of a medical error or whether it is a case of angry patients, then you're going to go forward with what kind of protocol you're going to follow. In the case of if it's a fault by hospital side, then we are going to follow a protocol known as cones, which we are going to discuss further. But if it's an angry patient, then we are going to deal with the typical ethics protocol, which have been already taught by Mr. Dr. Manikandan and Dr. Sibi. Is that okay? Okay.
Yeah.
So next is medical errors. So what is there in medical errors basically? As I mentioned that we have to follow a approach known as cones. So what does cones means? As I've written, C is for context. Basically, we have the moment we enter, we have to be prepared what we are going to say. As you know that we have been given 1.5 minutes for preparing about the question. We'll read the question. Okay, so this is the question, so we'll have an idea. Okay, this is a medical error case. I'll tell you what happened during one of my mocks. There was a case of lost biopsy. There was a renal biopsy case, and renal biopsy is something which is very difficult and which is very painful thing. So that is something which was lost, and we have to tell the patient, okay, the your renal biopsy is lost. This is a very tough task, honestly, guys. So you have an idea, okay, what we have to talk, what we are going to say, how we are going to react. So what we are going to do is we have to go inside like with a neutral face, calm down, smile, and like relax, and then we have to paraphrase what is written outside. For example, we'll start firstly. Okay, so tell us what happened when you came at the first place. We'll ask from patient, okay, what happened. We'll make the patient speak, okay, what happened, what he felt, how was everything, just to make him comfortable. That's something we call as small talk, which is very important, because that is something which makes patient comfortable, and patient can talk to us very frankly and friendly, like, okay, he listens to me, he's listening to me already, so I can talk to him. Then comes the point where you have to go for a opening shot, like, okay, so the mistake has been made from our side, how are you going to tell this thing? Basically, we have to alert the patient, or maybe the patient's relative may be present at that point of time. We'll be like, okay, we have some information for you. That is something which we were also not expecting, but unfortunately a mistake has been made from our side. Use some like that, paraphrase it, use your vocabulary, be smart in this. But yeah, you have to do a opening shot. That is very important. Give an opening shot. It will be very helpful for the further case. That thing may make the patient angry, but it's fine. He won't react that much because you have already created a comfort between a patient and a doctor. Okay. Then comes N, that is narrative approach. Suppose we have already told him, okay, so we have made a mistake. Then we'll go for, okay, so as you mentioned, then we'll be like, okay, so you have already mentioned that this went through. You came for to the hospital for a biopsy. Then there was a biopsy. We carried it on, and then it is then we'll tell what happens in ideal scenario. Then we send it to the lab. Lab people label it, something like that. Okay. But then you have to use one thing, that is the word but. You have to be very careful where you have to put this but, and be like, okay, but the mistake has been made, but unfortunately your biopsy report didn't reach that place. You have to tell them. Okay. Then we are going to have something known as E. Because if we have told that something bad happened, then the patient will, or the relative will automatically be angry. Suppose, as we were discussing about the lost biopsy thing, The patient will be like, oh God, I went through so much pain. He'll literally act like this: doctor, why did you do this with me? I went through this much pain. This thing happened with me. When I came to the hospital, I couldn't walk for 3 days, 4 days. He will be very sad. Remember to remember to acknowledge his emotions. Remember to ask him again, okay, how are you feeling? And one golden thing here is apologize. Apologize after every sentence, because a mistake has been made. Your apology may help him a lot, because honestly, patient is someone who has to go through the pain again because of our fault. So at that point of time, we have to use emotions, we have to acknowledge the emotions. Okay, and definitely in the end, reassure. Okay, I know it, you have to tell him that you're very disappointed, that you can have to tell that, okay, I can see you're very disappointing, something bad happened, I'm really sorry about it. After you have done this, okay, then ask, what is the main concern you have right now? Suppose the patient says, I'm needle phobic, I'm very scared of needles. Then you're going to give him the points like, okay, I'm going to ask the most experienced surgeon, most experienced medical practitioner to carry forward with it. If he's like, I'm still it's still painful, I'm like, okay, I'll use the better numbing agents. I'll put the extra numbing agents. You have to just make him comfortable and make sure that he won't face any difficulties. Ask one more question as well. That is something which I prefer asking is, what happened? What uncomfortable thing you faced in the last time? If he'll start saying, okay, this happened with me, that happened, make sure you provide solution to those things. Okay, and then once that thing has been done, then the most important thing is strategy and summary. Basically, you have to tell him, okay, how we are going to deal with it. Suppose it's a renal biopsy, you're going to tell him, we're sorry, we are going to give you one more appointment for the biopsy thing, and then things can get sorted. Is that clear? And we have to explain that we shouldn't delay thing, but still the patient is very angry, he's complaining, oh, why you did this with me, then that. Then tell them, we are going to take place a meeting known as significant analysis meeting, which is very important. Basically, I'll tell you one thing, what happens in significant analysis meeting. So it is a kind of a meeting in which we analyze about a particular incident which happened. Consultants sit in that, nurses sit in that, other medical practitioners sit in that. So we'll tell them that we'll take care. Still, the patient is not ready to take this answer. Then don't overspeak, just say about significant analysis meeting for the initial time. If still the patient is angry, because once you enter that room, the patient will be angry, he'll be like, no, this is not right, I don't care about your significant analysis meeting. And trust me, this thing happens. And one more thing, don't get offended, don't take anything personally. You have to offer the next best solution. Be like, okay, we'll review the guidelines and the protocols which our hospitals are following, because of that this mistake happened. Still, the patient is angry, he's very much angry, he's not ready to take it. Then use your next move. That is, okay, we'll discuss this with our consultants, and our consultants will have a chat with you as well. Okay, then in the end, if still the patient is not ready, you can ask him, you can always complain about us, you can always provide the feedbacks to a PALS, which is a very important thing in UK, patient advisory liaison unit. So what happens in that, in PALS, is patients can give feedbacks about a particular doctor, about a particular situation, and mind you, hospital takes those things very seriously. Okay, once you speak PALS, there are 99% chances that the patient will be okay, he'll be like, okay, I'll complain to PALS. Your work is done honestly at that point of time. Then you have to tell him, right now our priority is your health, speak good words. If you say our priority is your health, we would like to see you on a follow-up, we would like to see you on the next appointment, where we have to carry forward with a renal biopsy or anything like that. Okay, by this time, hopefully your session by this time, hopefully your this thing is going to get over, your the whole station is going to get over. Is that fine? Okay, so yeah, so once you have entered the room, okay, so then there'll be few common questions which the patient is generally going to ask. The first important question is, whose mistake was it? This is something which is a very tricky question, and you should be prepared about it. As I mentioned in the start of the class, this is something for that this type of scenario is something for which you should be prepared. Because if you are inside and this question comes to you and you're not prepared, whose mistake was it? Will you be able to take someone's name? No. Will you be able to just manage the situation? It will be very tough, guys. Trust me. At that point of time, you'll be having your adrenaline rush. So just relax. Remember, you shouldn't blame anyone, and just apologize at that point of time. One of the answers which I thought about was, while I was preparing, was, at the moment I do not know whose fault it is, could be, but as an individual I will definitely take care of about it. Okay, it could also be a failure of system as well, and I'll definitely investigate about it and get back to you. Your health is our priority. Be like this. Be very calm, be very smooth. They will understand. Okay. Then the next question which can be asked by the patient is, how often does that happen? You know what, patients are very angry at that point of time. Patients will be like, you have a shitty hospital system, and literally they use these kind of words. I'm not joking about it, they use these kind of words. So if the patient is like this, you have to be very calm. Again, I'm repeating, don't take things personally, don't take anything on your ego. It's fine, it's just a station. After that, it's over. They are actors, they are doing their work. If this thing happens, just apologize and give one answer. Unfortunately, I don't have any information right now. Okay, I will get into it, I will look into it, and will let you know as soon as possible. Is that fine? Okay. Okay, the next question which the patient can ask is, how did it happen? Okay, so here you have to use your narrative approach. You can skip this question, how did it happen, is if you will be using your narrative approach. But if suppose you have lost the biopsy or something like that, whose answer you don't even have. Okay, suppose the biopsy has already been lost, what will you do? Then you'll again apologize and be like, I will investigate and will be honest and open about what happened, and again use that line again, your health is a priority, I'll tell you soon. Okay, what are you going to do to make sure that doesn't happen? As I told you about the strategy, what we are going to do, suppose it's a renal biopsy or whatever it is, whatever the management is in your mind, just tell that at that point of time. And if the patient has reached at the point, what are you going to do to make sure that doesn't happen again? I am telling you, you have passed that station. This is a task to reach this stage of line. Okay, so what are you going to do so that it doesn't happen again? It means the patient is okay, he's not that angry, he's ready to listen about the solution. Okay, then we have few examples. Suppose a patient comes with the wrong reading of ECG. What happened was, it happened in the real life. In fact, in India, I've seen there was a missed MI case, which honestly, I'll accept the mistake. I missed that MI, but when my seniors review it, they found out that there was a MI because of T elevation. There was not whole ST elevation. There was some T elevation, which my seniors explained me, and I was very apologetic at that point of time. But they made sure to not to send me to talk to that patient. They sent some of their other colleagues, and we handled the whole situation very nicely. Okay. Similarly, there could be a fault in wrong X-ray reading. Sometimes there could be a wrong diagnosis. This happens generally in skin diseases because rashes. As junior doctors, it's difficult for us to recognize which kind of rash it is. So this may happen when the in the skin diseases. So you have to be very careful about that. And skin disease is something which is not an emergency, and you can explain the patient, okay, it's not an emergency, it's not that serious, we will take care of it, we will have solution for that. Okay, but as I was discussing the whole thing, the most important thing is lost reports like like lost renal biopsy. Guys, I have written it most important. Mind it, it is important. Write it down in your notes, it is important. Okay, prepare this one very well. Okay, next we have is dealing with angry patients. So why can the patient how can the patient be angry? Suppose if the patient is unhappy with the situation that he's going through. Suppose I'll tell you one thing, if the patient has been diagnosed with cancer, honestly that's not our fault, that's not anyone's fault, but still the patient is angry, and since he's going through a lot and he is a patient, and NHS criteria is one thing, care. care for everything, like care for their mental health, physical health, their financial support. So we have to take care of our patients. So if a patient is going through something like cancer or something traumatizing, or maybe the relatives are facing something because their respective patient is like not well, so we have to explain him all or her as well. Okay, then in the end is again the medical error thing, is unhappy with the hospital management. But I'll tell you a loophole in this one. What happens basically in when the patient is unhappy with the hospital management is suppose there is not the fault of any hospital. The fault is, suppose I'll tell you one thing. Suppose if we have asked that's what happened in real life with me. I asked a patient to put some ointment over the hand, but that patient, what that patient did was, that patient was putting that ointment daily, but he was not washing his hand. So that is something which he came and he was like, doctor didn't explain me well. He is very bad. He's this, he's that. He was angry. Understood. Maybe that was my fault as well. Okay, I should have explained him more clearly. Okay, you have to wash. That was my mistake. I took it a bit like I took it a bit like, okay, that is a common sense that a patient must be knowing. But this is something which we should take care about. So in this case also we have to take care of a patient as if we are dealing with the angry patient, and we have to go inside with a neutral face, and we have to tolerate whatever he's talking. You know what happens when you enter the case? The patient literally shouts at you. The patient doesn't even patient is not even ready to sit in the chair. You have to sit and calm down. Don't You shouldn't stand up, or maybe you lose your temper, or maybe you also stand up, you also get hyper with him. Don't. You just go sit professionally, act like a doctor, be a doctor there. If he's speaking, let him speak. Don't tell him anything. You know what happened with one of my friend, like in his case, when he entered the station, literally no one, he didn't speak even a single word. Only the patient was shouting, and he was just listening. He was just saying sorry, sorry, sorry. He passed that station because he let that patient speak. He didn't cut that patient. That is very important, because we have to make him comfortable, and if he is not speaking whatever is there in his heart, he can't continue with it. Okay. Okay, so now we have is approach on how to deal with the angry patients. We have already dealt with the medical errors, but now we are going to tell how we are going to deal with the angry patients. So firstly, you're going to enter. You're going to do your grips. You have to greet. Okay, hello, I'm Dr. So and so. I'm one of the doctors here, and you have to do your grips. Then you have to take a small history. How you're going to take that history? Okay, so what happened? Why are you feeling that way? He will tell you. Then the next question should be, when did it happen? Okay, just ask, take the history, waste the time, because this is something in which you don't have to reach a particular management. This is something which they analyze is how you are handling that particular patient. Okay, what happened, when did it happen? Then ask, okay, so tell us, okay, the patient may be having so many concerns. My mother is angry, I'm having a pain in leg, I'm having a pain in hand, I'm going through this, I can't come to the hospital daily, I don't have transport, I don't have money. So if the patient will generally speak about lots of concerns, at that point of time, ask the main concern. What is the most important concern that you're having, and which we should take care of right now? Okay. Then he'll be like, no, I have this. Okay, so then in terms of going forward, what would you like me to do for? Be very calm while asking this thing. It's okay, he will maybe not answer, but if he's not answering, repeat this question. Okay, what is the most thing? I understand that you what you're going through, sir, but please can you tell me what do you want me to do? I'll Your safeties are utmost priority. I will take care of you. I'll do anything which you say. Just be like that at that point of time. He will feel better, and he will tell you what you want. He will only give you the management. If he'll tell you, okay, I want you to arrange a transport for me for now, arrange a next appointment, change the doctor, something like that, be like, okay, we'll do that, we'll discuss about that, and we'll let you know. This way the patient will only reach the management. Okay, you have to drive the patient, don't let patient drive you. Again, I'm repeating, drive the patient. Give ask answer in the way the next you should be knowing what next question is going to be ask you. Okay, then acknowledging the emotion is very important, as you all know. It is something which you have to do in each and every case, be it counseling, be it normal history taking, be anything. Okay. Okay, so then apologize and take responsibility and be like, I'm really sorry for what has happened. This should not be happening and we should have things done better. Then again, reassure. Use the good line. Okay, I'm really sorry. I will take care of it. I'll make sure that the things are right. Then ask the problems, then give the solution. This way you can reassure and you'll be like, okay, things will try our best to make things better. Don't say things will get better, because at times you also know, and that patient also knows, things won't get better. Be like, we'll try our best to the things will get better. Then ask for a follow-up. We'll like to meet for a follow-up. We'll give you a call, we'll give you an email. Then maybe we'll have a, if it's a transport problem, then we'll have a video call appointment, we'll have appointment on call. Be like that. Then if the patient is still unhappy, then also in the end you're going to go for PALS. Yeah, you can go for significant analysis meeting, talk to the consultant, you can use points. But there's one thing, PALS, which patient advice and license services, which is very important, because you know what happens, sometimes the patient is so angry and he wants to listen to the word PALS, and that has marks. If the examiner is examining you, that person will have in mind, okay, when will this person say PALS? And honestly, patients are going to help you. So patients will be like, okay, so he hasn't reached that word yet. He's helping me. He's saying me these things, but he hasn't reached the particular word. They're just waiting for the word PALS, and they'll pass you. So just see the PALS. In the end, try saying PALS, even if the patient has agreed, because PALS is important. So thank you. So it was a very small slide which I made for you guys. It was a small topic. So now I'm going to just take few mocks with you guys. Are you guys ready? Anyone, please? Guys, I want your support in this, please. Diptanshu Sharma. Do you want to try?
Yeah, sure.
Uh, Nishita, I think your
Hi.
screen is,
Hello.
you know, I don't think your screen is showing the questions. It's showing your entire desktop.
Yeah, I'm
Can you
just
just check it?
closing. I'll just be dictating the questions.
Okay.
Is that is it fine?
Yeah, that's fine.
Okay.
That's fine.
Yeah. So hi Diptanshu, would you like to try one?
Yeah, sure.
Okay. So I'm going to give you a case, and then I'm going to give you 1.5 minutes uh, to just prepare for it. By the way, when is your exam?
Mine is on March 12th.
Good luck. You have time, but be prepared, because these days lots of people are failing. So just be very much prepared.
Okay.
Okay.
Yeah,
So
sure.
which academy you're using?
I'm using Samsung's.
Oh, great. I also use that one. Okay. So, okay, I'm going to give you a easy and a very important one, which is definitely going to get asked in your week only, I would say. Once
Okay.
in your week, it is definitely going to get asked. Okay, so FY2 in a renal unit, your FY2 in a renal unit,
Mm-hmm.
um, John, and 28-year-old man who was admitted with a suspected chronic kidney disease. Okay,
Okay.
he had a biopsy, renal biopsy, taken 7 days ago. You have been waiting for the results. When your department talked to the lab, the laboratory department said that they did not receive the biopsy. A thorough search was conducted to find the biopsy, but it was not found.
Okay.
Talk to the
Okay.
patient, explain what has happened, and address the concerns. So it's a lost renal biopsy case, which we have discussed initially. So
Mm.
this is something which you have to do it. So now you have an idea, and this is very important, guys. I'm telling you, just focus on this one. So should I start the timer for you?
Yep, sure.
1.5 minute one or 8 minute one? Right now it's one and a half
One
minute. If
minute.
you want to take time,
Okay. It's
so it's 1.5 minute.
yeah. Okay. Okay. Yeah, sure.
And Prezi, next you are going to do, so be prepared. Good.
Okay, should I begin now?
You ready?
Yeah.
Okay. Enter the room.
Okay.
Enter the room.
Hello, examiner. My name is Dr. Diptansu. My GMC reference number is this. Okay. Hello.
Hello.
Good morning. I'm Dr. Diptansu, one of the junior doctors in the department today. So you are John, right?
Yeah. Hi, doctor. How are you?
Hello, and may I have your date of birth, please?
Yeah, sure. My date of birth is 24th of August and 1998.
Okay, thank you. Okay, so John, I
Doctor,
can see
I'm
from my
here for the results. Doctor, I'm here for
yeah,
my
yeah,
results.
yeah, sure. I'm going to tell you about your results. But may I ask you a few questions first?
Sure. Why not?
Yeah, sure. So I can see from my notes here that you had renal biopsy. Is that correct?
Yeah, you're right. And I came for the results only, doctor.
Okay. Yeah, sure. I can see that you're quite excited to know the results, and I'll give them to you shortly. But can you tell me more about your renal biopsy?
Doctor, it happened like 6 days ago. I was in pain.
Mhm.
Then doctor did some ultrasound or something like that, and he was like, "It's better you go for a biopsy." And then the biopsy was so painful. Like they literally put a needle inside my tummy. It was so pathetic. Like I don't know. I don't want anyone to go through something like that.
Mm,
They just did that biopsy. I don't know. And then that nurse was also very rude. Like I was telling her again and again, okay, I'm going through some pain or something like that, but still she was continue doing it. But it's fine. Okay, now I'm free with it. I hope I'll get better now, doctor. You know what
mm,
I'm going through?
yeah, so I can see that you had quite a bit of an experience. I'm sorry to hear that it was not that very comfortable. Uh, so you're feeling good now? Is there any pain?
I'm better. I'm better, doctor. It's just I'm worried. It's not something serious which can take a toll on my life, or maybe my life can suffer. So you know what I mean. I'm so young right now. I don't want to
Mm.
go through anything like that. I want to solve all the problems as soon as possible. I hope you understand.
Yeah, sure. That's good. That's a good attitude. Okay, so you don't have any fever now. Is there any fever or discharge from the biopsy site? Have you noticed anything wrong?
Luckily, no, doctor. That is
Okay.
something which I'm very grateful for. Thank you, doctor.
Okay.
But no, nothing like that.
Okay, so that's good. Okay, so can I ask why the doctor thought that you need to had biopsy? Was there a reason that he said
Uh,
maybe?
As I mentioned, doc, it was I think my pain because my tummy was paining. I was having a rolling pain. So initially, doctor suspected it is a kidney stone, but in ultrasound there was no stone. So
Mm-hmm.
he ordered for a biopsy.
Okay. So, so John, what normally happens is after we have a biopsy, okay, we label the biopsy sample and send it to the lab so that they can do their investigation. We call up the lab for
Okay.
reports. Yeah, but you see, there has been an error from our side. Okay,
Oh, I'm sorry. What, doctor?
yeah, so there has been an error from our side. Okay,
What kind of an error, doctor?
so like I said, we send the biopsy sample to lab and we call them up so that we can have a report. But when I called today, they said that the sample had been misplaced.
What do you mean by misplaced? Why does this? What do you mean? It was my biopsy. It was a part of my skin. How can you biopsy? How can you just forget it or maybe lost it? I don't know. No, doctor. This is very unnatural and unreal. I can't believe it. It's not a piece of pen or piece of paper which you have done it.
Mhm.
It was
Yes.
it was a skin.
Yes, I'm sorry, and I can see that you're disappointed. and your disappointment is very justified. Even I am disappointed with the service that we provided you. But you see, we don't know what exactly went wrong. We are doing everything we can. We conducted a thorough search to find your sample, but we were unable to find any.
Okay.
And we
But do
called
you
up
have
the
the
lab.
reports for the sample?
I'm sorry to say, John, that we don't have the reports.
Seriously, doc, then
Yes,
how will you catch my disease? How will you know what I'm going through?
yes. So uh, uh, we without that report, okay. So without that report, we will not be able to diagnose what exactly happened to you. I'm sorry to say that. And we had appointed you for a renal biopsy in the first place because we needed to find out what exactly happened to you. Okay, so
Doc, okay,
we will,
then what did you expect?
yeah, so uh, I was here to ask you maybe to make a second appointment. Have you here, okay, and maybe perform a renal biopsy again. And and I can
Doctor, what do
understand
you
if this
mean?
sounds
Do you
very
want me to go
insensitive.
through that pain again? Yes, it was painful, doctor, as I
Yes,
mentioned.
yes, yes, yes. Yeah, I can totally understand what you're feeling right now. Okay, and I cannot even imagine what you went through. But without the proper diagnosis, uh, I'm I'm sorry to
Okay.
say that your disease might get worse even without a proper treatment.
Oh God, doctor. Does that happen regularly in your hospital? What kind of a hospital is this?
I can see that you're frustrated, and your frustration is very justified. And I'm like I have given you a news that is very bad, and you
Very
obviously
bad.
have some questions. Yeah, you obviously have some questions, but at this point of time, I don't have all the answers to your questions. But I can assure you that we will do everything in our capability to find out what exactly went wrong and who, if anyone, was responsible for this. And we will also conduct a root cause analysis meeting
Oh,
to find out what exactly went wrong.
okay, doctor. But still, I'm very disappointed. But doctor, what will you do now so that I shouldn't go through that painful biopsy again? Because as I mentioned, it was very uncomfortable at the first place.
Yes,
You know what? I'm already scared of needles and this thing.
yes, I'm really sorry, John, that you had to undergo it in the first place, and now we are scheduling you for the second one. I'm really sorry about that. But what I can do from my side is that I'll arrange a very experienced surgeon, okay, with very good hands, so that you won't feel much pain. I'm also going to give you. I'm also going to arrange for you to get a very good
Time
numbing
over.
agent. Okay, thank you.
It's okay. Uh, Please answer about if the patient is needle phobic, what will you do? Give me 3 points. What will you do?
Okay, so I'll arrange for a very good surgeon. I'm going to arrange for a very small needle, and I'm also arranging for a numbing agent, anesthetic agent.
Very good. Okay. So, you were good. One thing which I was very impressed about from with you was you answered few questions before me asking them. It was a good thing because if I would have asked those questions, it would have wasted your time. And you dealt with those kind of things very smartly, like you said, I'll see who has done this, whose mistake is it. Unfortunately, you said that on your own. That was a good thing, because if I would have asked that question, if the other patient in the station would have asked this question, he would have taken a lot of time, because he's an actor, he's going to act for a long time. Okay, so that was something which was good on your part, but let the patient speak as well. Because when we
Mm,
started, the patients at times are very good. When I ask, okay, doctor, how are you? Because it's not necessary for you to always ask the patient, how are you? At times, patient can also ask. Go natural. Just it's a conversation. If someone is asking you for the first, okay, how are you, doc? You have to answer him now. You can't go
absolutely.
just ahead. Okay, I'm so and so, how are you, and all. Just firstly answer. It's a conversation.
Okay.
Don't go like rectified thing. Okay, this is grips which we are going to do. You don't know what
Okay.
happens. Keep that grips in mind. Accommodate it wherever you can, but don't go and speak it like anything. Just wait for the patient also to say. And
Can
one
I
thing,
can
take
I intervene,
pause.
Nishita?
Sure.
Yeah, sorry to disturb you guys. So, like what Nishita was saying, don't follow the structure very ardently. Yesterday, I was taking a mock, and one of the students asked questions about, smoking, drinking, and recreational drugs in a question which where patient had gonorrhea. So, if you blindly follow
Ah,
things like that, it will affect the station because you are not supposed to ask any questions when it's not relating to the station. So filter out what and all you can use in Masters or Grips or whatever copies or whatever things you've learned, and like do it relevantly for the station alone. Don't superimpose it and do everything just because you have to do it. That's all.
Sure, sure.
I definitely
Okay.
agree with Sibi, but luckily you didn't do anything like that in this case. But just be careful about this thing, okay?
Okay.
This is very right. You can offend the patient. And as I was telling during my whole presentation, you have to drive the patient in this scenario. Don't let the patient drive you. This is something which you understood and which I'm proud of you. You understood what I meant. Just drive the patient. You should be having in your mind, okay, what should the patient next ask you? That is something which you did very nicely. Only thing missing is take a bit pauses, be a bit polite. You know what, this is something which guys lack. That's what I feel, but it's fine. You have time till March, you'll be able to do it. Okay.
Thank you. Thank you. Thank you very much.
Uh, and what about you? What do you think what you could have done better? Because one who is actually a doctor has things in his mind. Okay, may have done this thing wrong. Please tell us what you think you may have done wrong.
Yeah, so I was speaking when you were speaking. I think I cut you off sometime. Yeah, that was not good. I
Okay.
think at one part
Okay.
I was cutting you off, so that should not be done, I think.
Yeah.
Okay, and
Okay. And
um, I'm sorry, I don't have any knowledge about this, so
you're
I
okay
don't know.
according
Yeah,
you're okay. No, no, I'm just
yeah, okay.
asking you. You think you were okay? If you think you were okay, then it means you're okay. Trust me,
Okay,
because
okay.
this is something where you have to be yourself. If you think you
Okay,
were okay, it's okay. The pauses thing is there because honestly speaking, pauses thing is something which is difficult to take place on the Zoom call because we are not talking in person. If I'm talking in front of you, you will not cut me. That's what I think. As a
okay,
patient, you won't cut me. So that is
okay,
okay. You'll improve with time. You have time till March. So you can do that. But the good thing is you knew what you should have asked. That is something which I really liked. So very nice.
thank you.
So next we have is thank you. Yeah. So and anyone wants to give feedbacks to Tanshu, it's you guys are more than welcome. Vijaya or Yvonne, anyone who wants Praisy maybe. So next up we have is Praisy. Praisy, are you ready?
Yeah, okay. I haven't done this before, but yeah, I'll give it a try.
Yeah, definitely. Okay. So I'll be giving you one from angry patient. Is that fine?
Yeah, okay. All right.
Oh yeah, and there's one thing which I wanted to tell you guys in angry patient is there's a case which may happen of a mother and a son. Okay, mother is admitted, but the son is angry about the fact that why was he not informed about his mother's unwell health, and in that case, the mother is already under palliative care. So when that son comes, the son is more concerned about why he was not told about the things going on instead of his mother's health. So this is something which you guys might get confused whether it is an angry patient or whether it is a breaking bad news. Okay, so this is something which you have to be very careful when you enter the station. You have to notice the expressions of the patient or the relative or the son or whosoever it is. Notice the expressions. That is important in this thing. You may get confused whether it is a breaking. Oh, you have to tell him about his mother's cancer. But no, at this point of time, your priority should be calm him down, calm his anger down. Okay, then in 8 minutes you will just be able to calm his anger down. Guys, honestly, you won't be able to break them bad news. So for that purpose, don't take that station like a breaking bad news station. Take that station like a angry patient station. Okay. So next I'm going to give Crazy yeah, this one. It's a bit tricky. Good luck. Okay, Crazy, are you ready?
Yeah, I'm here. Yeah.
Great. FY2 in acute medical unit. A 40 years old female wants to leave the hospital. She was admitted 5 days ago with infective endocarditis. Currently receiving IV antibiotics, supposed to be given for 2 weeks. And she is an IV drug user. The nurses have been advising her to stay in hospital, but she is reluctant and wants to leave the hospital. The nurse has asked you to talk to the patient. Talk, assess the situation, and address the concerns.
All
So
good.
basically, she was admitted 5 days back because of some disease known as infective endocarditis. Okay, and
Mhm.
she is on antibiotics. Okay, and she's supposed to be given those antibiotics for 2 weeks.
Okay.
But she wants to leave within 5 days because she's a IV drug user and she's having that thing to use drugs and all. Okay, so she's angry on you. So it's a bit complicated case because here the hospital is not at fault. The problem is with the patient because she wants to go to use drugs, and as it's a hospital we can't give drugs to her in the hospital, so we have to give her the solution. Can you do that?
Yeah. So here the patient can't be angry, right?
The patient is angry because she wants to leave and we are not ready to let her leave. That's the thing. So the patient is
Okay.
angry because of that.
Okay. All right. Yeah. I'll pay.
I know it's a bit complicated. Good luck, but give it your best try. It's a very interesting one as well. You can ace it very easily. Just be very chill in this and relaxed. How you're going to deal in your hospital, be like that. Okay.
Okay. All right. All right. Thank
Good luck. So
you.
I'm giving you uh 1 minute 30 seconds. Just keep things in your mind. You ready?
Yeah. Yeah. We can start.
Start.
Sorry. Can you tell me the name again? It's
Jenny.
okay.
Wait, I'll start this timer again. Start. Doctor, what is this? I want to go home. Why are your nurses not allowing me to go home?
Oh, hi. You're Jenny, right?
Yes, doctor. Can I go home now?
Yeah, sure. Give me some time. Let's have a chat first. Is that all right?
Okay, doctor, but just make it quick because I really want to go home. I want to inject some heroin.
Yeah, we'll see what we can do about that. Kindly have a seat and we'll have a small chat before we decide what to do. So I can see from my notes that you've been admitted to the hospital for like
Yes,
just a
doctor, and you
week.
people don't even allow me to go.
Right, I can understand. So can I ask you a few questions if you don't mind before deciding?
Okay, but can I smoke first?
Give it a time. You just need to relax for a bit. Just a few questions and you'll be done. Is that okay? Can I proceed? Just a few questions.
Okay, doctor. Please make
Yeah,
it quick.
sure, sure. Thank you. So, how's your hospital stay been?
Doctor, it's not good at all. I'm not able to smoke. I'm not able to inject anything. Doctor, I'm an addict and I have accepted that, but I need it. Please, doctor, understand. At
I can
least give me something so that I can sit and talk to you nicely. Or maybe I can stay in the hospital if you want.
right. I'm really sorry for what happened, and I understand what you're going through. But can we talk a little more before we decide what can be done before that? Like, for example, can I like tell you about your condition in detail before we decide if you can go ahead with your discharge or whatever? Is it okay? Can we
Yes,
have a
doctor,
little chat?
sure.
So,
Okay, doctor.
so what was the what was your condition when you came here? What was bothering you? What brought you to the hospital? Sorry.
Doctor, I was having fever and then I was having some chest pain. That's all.
All right. So when did it start? If you remember.
I think, doctor, a couple of weeks back, maybe.
Mm-hmm. All right. So I guess uh you would have known about the condition that you have already, right?
Yes, doctor, somewhat, yes.
Yeah. So can you tell me what were you told, or how much do you know about the condition that you have already?
Yes, doctor, I think I have some heart disease, some infection in heart. That's what I've heard. I
Exactly.
think infective something, endocar, some, I don't know, something like that.
Exactly. You're right. It's good that you remember that. So it is a condition called infective endocarditis where there's some infection in your heart which can be quite serious and it can lead to a lot of complications. And I would really recommend you to get the course of antibiotics, which is for like 3 weeks. So I think they would have been very clear with all that. And I can also understand that you will be experiencing a lot of withdrawal symptoms.
Doctor, what do you mean
I
by
will.
withdrawal symptoms?
Okay. So the urge that you feel like you want to do drugs again and you want to smoke, right?
Okay, but doctor, I thought withdrawal symptom is something when we shake or something like that, we vomit.
Right, right. All right.
Because that's what happened with my friend.
So yeah, those are the late complications that you get when you are an addict. So as you are in a hospital setup, you are in a very good hand, and I will definitely talk to my senior to give you medications in price to keep you under check to prevent you from getting any of those symptoms. And for now, I would really recommend you to stay here for a while and get the IV antibiotic course. Do you have any other questions?
Doctor, but I'm not getting why IV. Can't I take just tablets? I'll eat all the tablets daily. That's my promise.
Oh, that's a very good question. But this is an infection that is treated with antibiotics, like through your blood vessels, through your veins. Like it
Why?
has to be treated for
Why
three
not
weeks.
orally? Why not
It
orally,
is,
doctor?
yeah, because when it is given through veins, it is more effective. And I'm afraid with this type of serious infection, we can only use antibiotics uh, through veins.
Doctor, what
So
do you
we
mean
would
by
recommend.
serious? Can I die? Doctor, please tell me.
Right. Um,
Doctor, are you there? It's okay, go for it. It's okay, you're going doing great. This will happen. You have to manage. Don't think you're doing anything wrong. Go for it. Come on.
okay. So there are like a lot of complications that can occur due to infective endocarditis, the condition that you have. Like, for example, it can lead to abscess and rupture inside your heart. It can lead to a lot other complications of heart. Like, for example, it can even lead to heart failure. I'm not telling all these to scare you, but I want you to be safe, and we want to care for you, and we don't want any of the complications to affect you in future, right? And provided you
Yes,
also
doctor.
have, yeah, you also have uh, you just mentioned that you are an addict. I don't mean to offend you, but yeah, so you have some risk factors. So we would like you to stay and get the treatment completely before hand. So yeah, are you convinced yet? So
Okay, doctor, I will listen to you only on one condition, if you allow me to smoke one cigarette.
So I actually can give you an option to smoke in the smoking area that we have in the hospital.
Okay.
Is that
Okay,
okay?
doctor. Okay, for now it is okay. And doctor, what about my urge to take drugs? How will you handle that?
Yeah, I can talk to my seniors and give you medications regarding that. So I'll make sure that you won't
What
have.
kind of medicines you will give me?
I don't know. I'm sorry.
Methadone. It's okay. Time is over.
Yeah.
It's okay. It's okay. It was a complicated case also, and I think you've heard this case for the first time, right?
Yeah.
Okay. So since you made a mistake by saying it's a kind of a serious disease, right?
Yeah, I did.
And the patient will be like, okay, doctor, am I going to die? So is answer this. Anyone has to answer this. Now let's see how you're going to use your IPS here. Think of an answer. Diptanshu, Vijaya, Yvonne, I want you guys to answer as well in this, please. If the patient says, doctor, am I going to die, this thing is going to happen in breaking bad news, this thing is going to happen in all the ethical cases. Please answer this thing. Anyone can answer.
Can we tell there's a possibility, but it can be managed and avoided if he continue to stay in the hospital with all the medical professionals giving proper support?
Okay, very nice. But there's one thing which you should have also said before this thing is, I'm sorry to give you that impression. Apologize, because this way you have shocked the patient. You getting me, Yvonne? What
Yeah,
do you
yeah.
think about this line? So now tell me how you're going to answer this thing. Doctor, am I going to die?
I'm sorry that I give you that
Go
impression,
for it.
but the risk of that is going to be very low is with proper managed in the hospital.
Very good. Got it?
Okay.
What do you think? Which one was sounding better? This one or the earlier one? What do you think? Give your views. Don't trust me. Don't trust anyone. Give your views. What, as a patient, what would you like to listen more?
Uh, the second one is that feeling
Okay.
will be
You
comforted.
just have to, exactly. You just have to make the patient comfortable here. Clear?
Okay.
Thank you for answering the question. Yeah. Okay. Preeti, got it?
Yeah, got it.
How are you going to deal with that kind of a situation?
Yeah.
Great. Okay, so the next thing which I asked you was about the medicine we give for the as a and as like for leaving heroin or something like that.
That
Anyone can
methadone.
answer, Yvonne, Vijay? Yes, very good. Okay, now you're clear
But
about that.
are
Um,
we eligible to prescribe methadone, or should we?
No, you are eligible, but it's better to be safe at that point of time, because you're not sure if she's literally addicted to heroin or not. So it's better you leave that decision to your seniors. We'll do some investigations over you, and with our seniors, we'll decide what kind of a medicine we are going to give. Most likely, we are going to give you something known as methadone. Be
All
like
right.
this. Got it?
Okay. Yeah.
Don't give a sure shot. Okay, I'll give you this, because she's an addict. Honestly, she'll say, I'm taking this. You don't know what other drugs she's taking. So for
Mm.
that, you have to do the proper investigation and discuss with your senior. Okay, which is the best suited medicine, or which is the best suited antidote for her. Got it?
Yeah. Yeah. Got it.
And then there was a question about the cigarette, if she can smoke. In
Mm.
that thing, don't take things in your hand, my dear. You'll be stuck there. You can't allow her to go and smoke on your own. You
Oh.
have to discuss with your senior, and then you can do that. Is that fine?
All right. Yeah. Yeah.
Don't take anything on your hand. Just say everything on the basis of your senior. I'll discuss with my seniors, and mostly we are going to do this because this way the examiner will know, okay, you know things. And the best part is you're playing a safe doctor because you will be discussing with the senior as well. Is
Right.
it fine?
Yeah, yeah.
Okay,
Yeah.
because trust me guys, this is a exam where you have to play very smart. It's so even if you haven't studied, please be smart. If patient asks, can I smoke, we can say we will discuss with the senior. Yes, definitely we will consider this and we will discuss with seniors, but for now please calm down. You have to discuss with the senior. Don't take things in your hand here. Okay.
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 And then what mistakes you made was you should have like built a bit of repo. Okay, how you feel if you did that, how is this stay going on? So what happened, you should have taken a crisp history about, okay, when you came to the house, when did the pain start, how was it affecting your day-to-day activities. It is very
Yes.
important. Okay.
Mm-hmm. All right.
And okay, and then you should here, it was very important to ask about smoking, alcohol. You should have done the PMF sir, basically about the this thing about the smoking and all. You it was very necessary here. Okay.
Right. All right.
Okay, and then what was missing was, yeah, you should have asked about the family as well, whom she lives with and all here,
Okay.
because she is not able to take her own decision. We are not even sure. So firstly we have to assess the capacity if she is able to take the decision, and if she is not able to take the decisions, we have to involve the family, or if there's no family, we have to involve the judiciary. Okay.
Okay.
Okay, and then it's gonna see one people would die if they're not. Otherwise, you did everything was quite good, quite okay. But one more thing, look, Praise, honestly, at times you will have situations there. This is for everyone, in fact, that you won't know, or you may feel, oh shit, I did a mistake. Now I'm stuck. She asked me this kind of a question. She got this, but trust me, it doesn't mean that patient is just acting for you. It's on you how you have to. It's not real, like, okay, if he's not reacting, it's in reality, oh god, will I die, will I do this? Don't get nervous, just deal with the thing smartly. Do your acting, be very calm, just deal with it smartly. Don't get nervous, because just keep in your mind, you are a doctor, you are at a upper position here. You have that mind, you are bound to answer all the questions asked by the patient. Don't get stuck there, don't get silent, speak anything. Instead of getting silent, speak a sorry. That's all. Sorry is the best medicine. I'm sorry to give you that impression. I'm sorry you're feeling that way. Use sorry, but don't get stuck. While you're speaking that sorry, your mind will work. You'll have an adrenaline rush, and you'll definitely get an answer. Okay, this is something which I'm telling you very practically. You may be thinking, oh God, she's taking things very chill. She's thinking, okay, we'll get. But trust me, this thing happens. This is not an exam where you have to ratify things, where you have to study a lot. This is not that kind of exam. Okay, trust me, you will be able to handle the situation. You handle your parents, you handle your friends, you handle your family. This is somewhat similar. You have to just handle the patient with your words. Okay.
Okay. All right. Yeah.
Okay. And any and Prezi, you tell what fault you had. What do you think you would have done better?
Mm, yeah, the same thing. I didn't ask the history properly. I just went with one question and I switched over.
Here,
And
patient drove you. Got it?
yeah,
Don't let
correct.
the patient drive you. You
Right.
drive the patient. Okay?
Right. Yeah. All right.
Okay. What else you think you did wrong?
And I have a question. So there's nothing like AMA and all there. Are we supposed to
What
like?
is
I
AMA?
mean, sorry, against medical advice, discharge against medical advice. Can we
There
recommend that?
is, I would suggest to not to recommend, because your 8 minutes will be over in the time you're convincing her. Trust me. Don't don't use it.
Okay.
Your it's just about 8 minutes. Your 8 minutes will be over. These are some stations which never get over. Okay.
Oh, okay.
And if the stations get over only if the patient is convinced.
All right.
Okay, and mostly the patient is will be convinced. If the patient is not convinced, just keep on convincing. Your 8 minutes are over, you go out, you have passed. Trust me. Just but don't get stuck. You give good answers. give words like this. You can use, okay, whatever problems she's having, you'll solve them. Use pals here. Okay, she's having a problem. Okay, nurses are supposed, there's a thing like, she'll be like, okay, nurses are behaving bad with me, nurses are not talking to me nicely. You'll be like, you'll look into the matter, you'll discuss with your seniors, you'll have a significant analysis meeting about this, why this thing is happening. She still not agreed about it, to go for pals. You are driving the case here. Okay, so these are few points which will be accommodated in the same case. You won't get a chance to give her a discharge. Your 8 minutes will be over. Okay.
Okay. Yeah, sure. Thank you.
Yeah. Any other queries?
Not really.
Questions
No.
you can ask, and in fact, you guys can simply text me personally as well. There's no problem about that. You can ask anything you feel like, because honestly, your exams are coming. By the way, when is your exam, Prezi?
Oh, it's on June 18th.
Okay. Good luck about that. Okay. So just ask whatever you feel like. And Yvonne, when is your exam?
April.
Okay. Hi, Sophia has joined. Hi, Sophia. She's not here, I think, yet. Sophia, are you there? I don't know. Hi, Sophia. I don't know. She's not listening, I think. Okay. So, Yvonne, when is your exam?
April.
April. Okay. And Vijaya, what about you? You there?
Yes, ma'am. Mine is on June 11th.
Okay. So, Yvonne and Vijaya, one of you wants to practice a case? Guys, volunteer. Trust me, it's okay. It may be your first practice. It's okay.
I can try.
Good luck. That's great. Okay. So, I'll give you one angry patient only. Is that fine?
Okay.
One of the important ones I'll give you. Wait. Yeah. Okay. So you are a FY2 in medical unit. Okay. Miss Thea, a 65-year-old woman, Thea, okay, was admitted 4 days ago with chest pain. She was diagnosed with MI. She had coronary artery bypass graft surgery 4 days ago. Edith Thompson is, Miss Thopia is upset, and she has refused to talk to the physiotherapist. Talk to the patient and address her concerns.
Can I have the patient name again, please?
Give her any name, Gupta, Mrs. Gupta. That whatever name you want to take. Give her any name, whatever you feel like. Okay.
Okay.
But did you get the case? So basically, she's a 65-year-old lady, or like, who had a chest pain, and then she underwent a surgery known as coronary artery bypass surgery. Clear? And then she's upset because she doesn't because she was told something about exercises, and now she's not ready to talk to the physiotherapist. Okay. Talk to the patient and address her concerns. Is that okay?
Okay.
Just a second. Vijaya has messaged something. I'll have a look. That's great. Okay, that's okay, Vijaya. We'll do a practice whenever you feel like. Just put a message in the Telegram group, and whenever I'm available, I'll let you know. We'll have a practice session alone if you want. Okay, it's fine. So I think this is the last practice session which we're going to have today, which is going to be done by Yvonne. Is that fine? So Yvonne, did you get the question, or do you want me to repeat it?
Yeah, I got the question. So basically it's Miss Sophia, 65 years old, done CAPG 4 days ago, and now want to refer to physiotherapist, is it?
No, she was having myocardial infarction.
Mm-hmm.
And then she underwent a surgery known as coronary artery bypass graft surgery, basically stent bypass surgery. Okay.
Okay.
So after that, because whenever you have a surgery, then we refer the patient to the physiotherapist. Okay.
Okay.
But she's angry about some exercise schedule. That is a hint which I'm giving you, and which that won't be given in your final question. Okay.
Okay. So,
If
good
you
morning.
want me to repeat it, I'll repeat it for you. Take your time. Be prepared. Okay.
Okay. So, good morning, Miss Sophia. I'm Yvonne, one of the doctors over here. Can I confirm your full name and age, please?
I am Sophia. I'm Sophia Hayat, and I'm 65 years old.
Okay. Sophia, I can see from my notes that you actually done a surgery for your heart 4 days ago. Am I right?
Yes, doctor. Yes, doctor. It was something like coronary artery bypass surgery. Now I'm better, doctor, but I'm a bit confused about few things because nurses told me something, but physiotherapist is telling me some other things. I'm a bit confused, doctor.
Okay. So, are you feeling better right now?
Yes, doctor, I'm feeling better.
Okay. So, what is the confusing part for you?
Actually, doctor, nurses were very nice with me, honestly, but they told me I don't know, yesterday they told me that I shouldn't do much work and I should take things very easy. You know what I mean? But then today morning I met my physiotherapist, Sarah. She asked me to move and do some exercises. So I don't want to meet that physiotherapist again because why is she making me do work when I've already undergone a heart surgery? Don't you think it is putting pressure on my heart?
Okay, so that's the usual procedure where we tend to refer patient to physiotherapies, which help to strengthen the muscles and also uh, teach the patients how to regain strength after a major operation or a major heart attack. So if the physiotherapy asks you to do certain exercise, they are experienced to know that what is the level that's suitable for patients like you just after major surgery. So you can follow their advice and alert them if you feel any uncomfortable or discomfort during the exercise.
But doctor, nurse was so sweet with me, but this Sophia physiotherapy is not at all good. She is so rude with me. I don't like her much, doctor. I don't want to go to her. I think nurse was better. Nurse was right about my things.
I'm really sorry that you didn't have a really good experience over there. We can try to talk. I will try to talk to the physiotherapist and get it addressed. Sometimes when the workloads get more, physiotherapists or other healthcare workers might not be very friendly, but do believe that we are always here to offer the best we can to all our patients.
Okay, doctor, but honestly, I'm very scared, you know.
You don't need to worry about that. I'm sure that all of us are ready to help, including the physiotherapists, and they are at the best positions to advise you how to regain your muscle strength.
Okay. But doctor, what if I get out of bed and I'll have another heart attack?
You mean while doing the exercise or?
While doing the exercise, or maybe after I do the exercise, because it's hectic for my heart. I don't want to affect my heart. I have lots of things to do.
Yeah, I do understand that. I understand where your concern is coming from. Usually, physiotherapy will adjust the level of activities according to individuals' needs. However, so patients will be the best persons to know themselves well. So if you experience any discomfort or you feel that the activity is too strenuous for you, you feel that you are not able to cope with it, you can always alert the medical professional over there at any point. So don't need to worry
Okay.
too much about that.
Doctor, are you sure I won't have a heart attack again?
I can't be sure, but the risk will be low if you are properly managed in the hospital, taking all the proper medications and uh, going through all the exercise program that we have scheduled for you.
How do you know, doctor, the chances are low? You didn't even do any investigations or examinations over me?
So you just went through a bypass. So Usually for the bypass, it can last for quite some time if you are adapting a healthy lifestyle and also following the medical advice and takes proper medications. So the risk of another heart attack can be much lower compared to if you didn't follow our advice and you didn't take any medications.
Okay, doctor. Okay, doctor. I'll take care of it. I'm feeling much better now, doctor. So, doctor, according to you, if I'm not wrong, you just told me to just follow the physiotherapy, do mild exercises. Am I right? To just build my muscle strength.
Yeah, you just follow their advice, but do let them know if you are at any point feeling uncomfortable.
Okay, doctor. But I have one query, doctor. Why didn't Sarah explain me like this? Honestly, she was very rude to me. I didn't like her because he was so nice. He talked to me nicely, but it was not the case with her.
I'm really sorry that you had that experience, but I'm not sure. Maybe at that moment she's quite busy or in the middle of something. So I apologize on her behalf.
But doctor, I want to change my physiotherapist. Is that possible?
We can try to arrange one for you, but maybe you can try to go to her and give her one more chance and see how things goes before we risk. Before you feel very uncomfortable, we can always try to switch to another person.
Okay, doctor.
Okay, thank
Okay,
you.
doctor. Thank you.
Thank you.
5 minutes, 50 seconds. You completed it. Yvonne, look, you were okay. Your IPS is nice, but whenever you're doing a case like this, it's a diagnostic case. Okay, it was a MI, and she was again and again saying, "What if I'll get this this again?" Don't you think you should have like ruled out few things? Like you should have asked it about the history. Like, is she having any kind of shortness of breath, or if she's having any kind of palpitations or chest pain recently? You should have ruled out pulmonary embolism because after this surgery there's a huge chance of pulmonary embolus. You should have asked about if there's any kind of swellings of legs. What do you think?
Yeah, I missed that.
Okay, so and examination, in fact, I as a patient told you, doctor, don't you think you should do some examinations? You were like, oh no, after surgery we don't give wrong info to patients. This way examiner gets offended. Patient may come in your talks, but the examiner knows everything, he'll get angry. Okay, don't
Okay.
say those things which you're not sure about. Okay, if you think, just carry on with the examination. If you say, okay, I'd like to do few examination, go for general examinations. In cases like this, generally the examiner will say it's all normal. Okay.
Okay.
Okay, and then there was one thing which I felt was wrong. Was I was like, I asked you one question. I asked you, doctor, I'm scared. I said this. You didn't do ice at that time. Is there anything particular which you think is scaring you? Why are you scared? Did you ask me that? Did you acknowledge my emotion?
No, I didn't.
Okay, it's fine. I'm just correcting so that you don't make this mistake in the final exam. Okay. And then okay, this thing is done. Otherwise your IPS is okay. How you doing? You did it very nicely. You explained very nicely about this thing, about the nurse thing. Okay, so why the physiotherapy is important, that was very nice. So that was very good. Okay, otherwise yeah, for mobility and yeah, for the physiotherapist apologized. And if I agreed in this, if by chance the patient doesn't agrees, you be like, okay, I'll have a chat with my seniors and let you know if we can change the physiotherapist. Is that fine?
Okay.
Okay.
Doctor, do we need to run any tests in this kind of situations if patients, like just now, complain that she afraid she might have another attack? So after the examination, do I need to conduct any test?
Yeah, no, at that point of time, if everything is normal, you can say it very confidently. Right now, all your investigations and examinations were normal, so you're free from the risk of the heart attack for now. But in future, we're sure about how things turn out to be. But currently, you are okay, and you can carry on with the physiotherapy. Okay.
Okay, thank you.
Because after doing the investigation and examination, just even if mentioning and you'll know everything is normal, you can tell her confidently, okay, you can do the physiotherapy. By chance, if I'll tell you, if I'm a patient, okay, I had a heart attack, underwent a surgery, but now I'm having leg swellings. Okay, and you will be very confidently saying, no, dear, no, what was my name? Whatever my name was. No, Sophia, you can go for the surgery, you can go for the physiotherapy, nothing will happen. Everything is fine. This is the case where you're playing a very unsafe doctor. Okay? Be a safe
Okay.
doctor. You're getting me?
Okay.
Because these are the
got it.
blunders which we can make. We didn't even realize, okay, that was not even our task here. What was our task? To convince, which you did very nicely. But there were small bits and pieces which you should have covered so that you can complete that confidently. Just rule out a bit of DTs, do our examination, everything is normal. In most, by chance, if something comes, then your whole case is changed. Are you getting me? Then the case is not of convincing her, then the case is of treating her. Okay?
Okay.
Go for
Understand.
examinations. Okay. Otherwise, everything was good. You're good. Okay. The best
Okay.
part
Thank
was
you
you
so much,
didn't stop.
doctor.
Yeah. And you tried to drive the patient instead of patient driving you. So that was something which I liked. What do you think about your thing? Like, how was it?
I think I completely missed history and examination. That's quite bad.
It's fine. Okay. So, Sibi, do you want to give any inputs now? By the way, thank you, Yvonne.
Thank you so much,
Not much of input. Again, we stress the same old things. You are not a consultant, you're just a junior doctor. Listen to the patient carefully, give advice one at a time. Always jump in, check, ask a question, and wait for a response or wait for the response and make sure the patient understands. Don't use any medical vocabulary which the patient might not understand. And in these cases, especially, make sure the patient is comfortable at the end of the station because that is how you're going to get your IQS marks. The patient is going to tell the examiner that they felt comfortable with this doctor. You're going to score well in IPS, and that's going to get you through the station. So yeah, very simple things, and please don't panic if you're in a situation where how you don't know how to react. Like take some time and react. Yeah, that is all pretty much it.
Yeah, Sibi is absolutely right. Thank you, Sibi, for your input. So, guys, take care of these points as well. And what I've taught you, please go and read the cases today itself so that you don't need to read that again and again. Trust me, whatever I have told you, and if you read the cases, you will pass all the stations, you will ace all the stations. Please just read those things today itself so that you get completed with these things. It was a very short topic and a very scoring topic because honestly you have very limited cases in this kind of scenarios, and this is something from which every week or maybe every day one case will come for sure. Okay, so these are the marks which you will get for free. Please read. Okay. Any other queries before we end the session? I hope you guys like the session. And if by chance you have any queries, you can just message me, text me on Telegram personally as well. And in the group, we all are very happy to help you. And in fact, with us, we have a very good consultant from whom actually we have learned, Mr. Manikandan Kathirwal. So he is the one who can help you guys as well. Through you can contact him through us, or maybe you can contact him directly as well. So you will, and trust me, you guys are not alone. You please come to UK. We are already in UK mostly by the end of the month. So we are very much looking forward to meet you all. So good luck for your future and don't lose hope and be confident. Okay. Bye bye.
Thank you, guys.
Bye. Thank you. We'll end the session.